Good evening and welcome to BronxTalk. Tonight's program is about something that's personal to each of us. Given the health challenges that so many in the Bronx face, combined with the broad diversity in the Bronx, it's vital that when you go in to see a doctor, that not only is it important that your gender and cultural identity is acknowledged, but that you are provided with health care that directly takes into account those individualities, because that can make a big difference in the success of treatment. In our studio tonight, we have two experts to examine how are we doing in delivering gender and culturally sensitive health care. So please join me in welcoming back to Bronx Talk, Assistant Commissioner from the Bureau of Health Equity Capacity Building at the New York City Department of Health and Mental Hygiene, Dr. Julain Watkins. Nice to have you with us. I appreciate to meet you in person, because we had you on during COVID and we were all, of course, in different places. So it's nice to see you, sir. And from the Oak Street Health Center, Senior Medical Director, Dr. Yonette Davis. Nice to have you with us, Dr. Davis.
Thank you, Diaz.
Let's start with you, Dr. Watkins. How does the department view this whole concept of delivering gender and culturally sensitive healthcare? How does it play? What do you do across your services, across the city services, to ensure that it's going well and that people are taking into account who they really are when they go to see a doctor?
Yeah, thanks. That's a great question, and it's central to everything that we do at the health department. The division that I work in, the Center for Health Equity and Community Wellness, that's the core mission of our division, and that's the core mission of everything that we do at the agency. We know
everything we do.
Everything that we do. We want to have
I wanted to emphasize that, because people say, well, wait a minute, is it really that important? We have other issues.
Yeah.
But you say it's everything that you do. Go ahead.
It's everything that we do, in that we have to have this racial and social consciousness. We know that not all New Yorkers are one way. New York City is the most diverse ethnically, culturally, religiously, linguistically city in the world. And we know that we need to really rely on those skills and tools and the language of health equity and understand what, diversity, equity, and inclusion means as we're creating programs, as we're checking, the well-being and health of people across the city. We know that these things sometimes don't level out equally across groups, and it's helpful to have this understanding and awareness so that we can actually do the job for all New Yorkers, because not one size fits all in a city like ours.
Do you want to give it a grade? How are we doing? I mean, and I realize that we all know what the health system is like. The city manages its own facilities, but there are other independents, of course, like Oak Street Health and so many others, especially in the Bronx. Do you have a sense of how it's going? Are these overall efforts successful? Still have a ways to go? It's one of those things that always has to be done. How do you view the thing?
I think when we talk about health equity and diversity, I look at it as a daily process. It's not an end destination. It's something that we're going to have to be dealing with and addressing as long as we're here, always. Yeah. So we have to have this awareness, because whatever the new thing that comes up, we have to have an awareness, like, how will this affect certain folks if they're not able to drive, if they're not able to walk, people who may not speak English as a first language. We have to have this awareness. So I think overall, that we're doing good. We're in a good place in that we have the awareness. We're thinking critically. We're looking for tools. We're looking for ways to improve how we do the work.
Is this all about training? I mean, because people need to know, providers need to know how to behave, how to treat people. Does that come from the medical school? Is that an ongoing thing? And certainly, Dr. Davis, we're going to ask you about Oak Street Health, which takes it very seriously. But is that really the bottom line here, that if doctors are trained, they can deal with it?
When we go to medical school and we take our Hippocratic oath, we're dedicating our lives to a lifetime of learning. And so, yes, training is one key part, gives us that foundation. But over the course of our careers, we're going to have to keep updating the information. When we learn different things, we know different things, it's supposed to influence and help us do better. When we know better, we do better. And so it's a daily process.
Last question before we bring Dr. Davis into the equation. What should a patient know, and what should a patient look for to say, well, wait a minute, Gary said it on TV, and now maybe I'm getting the short end of the stick here. What should a patient be thinking about when they go to see a doctor as regards these issues?
what patients should know is that sometimes it's not always best to be the good patient. You have to go in and know that, go in with your questions, go in and knowing that you deserve high quality care, you deserve care in a language that you prefer.
That's a big thing.
Right? You deserve to have your needs and your questions, responded to and asked. And so it's really having folks know it's not like we're going to McDonald's, but you definitely do have more of a say in this and to be an active participant. And you can actually take notes. You can bring a buddy, bring a support system. But the whole point is that you're entering a relationship with the provider, and it's a two-way street. We're talking to each other, and what are my goals and what are your goals for care?
Before we leave today, we'll talk about what happens if you don't see that. Dr. Davis, I know you're jumping out of your seat. This is what she is completely dedicated to. I want to give a shout out to my buddy Emily Swanson at the Bronx Times. They did a wonderful feature on Dr. Davis that explained your passion to ensure gender and culturally sensitive health care. Explain, if you would, in the one-to-one moments with patients, how does it come up? What happens in that very private moment when a patient, may be saying, I've got these very difficult problems?
So, can I just say this?
Yes, you can say it. It's an open microphone.
I love the Bronx. I love the diversity of Bronx. I live in the Bronx. I wake up in the Bronx. I walk the streets of the Bronx. And it kind of reminds me of my 10-year-old self. I was an immigrant from Guyana. My parents immigrated here for a better life. We immigrated to Brooklyn, New York. And it was somewhat of a new world. And as an immigrant, you're excited, but you're fearful. And I
10 years old.
10 years old. And I remember going to a big hospital in Brooklyn with, laceration. And I just remember the feeling that I wasn't treated like a human being.
Wow.
I wasn't treated as an individual.
You think because of the color of your skin?
I don't know if that's the case. I really don't know. I just know that the providers were seeing it through their eyes, meaning they were excited about a wound, but they didn't see that 10-year-old child who was scared, who was in a different country that she's used to, who maybe spoke English but spoke with a different accent, they were just being rushed. I just remember that feeling. I remember my mother not really understanding the system, and it was a very. I felt I felt like I lost my power there.
Wow.
And I left with that feeling that if I could be that advocacy for people who look like me, speak like me, who are just different, I think the healthcare system will be different.
And that's what you basically dedicated your professional career to.
Yes. And
beginning at the age of 10, what a wonderful story.
Right. At Oak Street Health, we take care of Medicare patients. Those are the patients at my heart. I love older adults.
Yes, you do geriatrics.
Geriatrics. Right. And we believe that at the core, just as Julain said, is communities should be looking at themselves as we want better care. We don't believe that you need to go from your community better care. We believe you could get better care right in your community. So the way we do the Oak Street Health, the way I do it is that I feel that when someone coming to an office, like I picture my 10-year-old self, I want to see people that look like me, maybe may eat the same foods like me, who, the surroundings are familiar.
And this plays in ultimately the comfort of the patient and how a patient will even accept instructions that sometimes, you got to stop eating that food and they don't want to hear about it.
I could give you an example I had 2 weeks ago. A new patient came to me and she was very angry. At least I interpreted her as very angry. So I want to let you know that sometimes as providers, we come with our own preconceived notions. And sometimes we need to leave that at the door. We need to leave that at the door. So she wanted medical care. I explained to her that I will have someone to help me type up my notes. She said, no, I just want you. And she was very angry. I asked her several questions. She said, why you ask me all those questions? I just came because I have this particular ailment. I said, you know what? I want to do something different. I want to ask questions because I want to know a little more about you so I can really advocate for the best thing for you. And I said, you know what? I'm going to close down my computer. I'm just going to sit and listen. And that was a longer visit. And at the end, she decided to follow up with Oak Street Health. And I realized that it was a learning experience for me.
To treat her in that way?
To treat her, because we have to flex by who before us.
We talk about it when it comes to policing, and that is profiling. And I was very surprised to hear you just say that sometimes doctors also profile somebody when they come in. That's how they express it. You mentioned the word, and I've got it in my own notes, that you said a major problem is the lack of medical empowerment. That was quoted in that article in the Bronx
medical
Times.
empowerment.
How does somebody get medically empowered? Now, knowledge, of course, helps, but of course, everybody doesn't. I certainly don't have the kind of medical knowledge. What are your thoughts? And then I'm going to ask you too, Dr. Watkins.
I would say every person in the Bronx, in the United States, coming to see a provider should feel empowered to ask questions. The way you empower yourself is just to ask questions. When you start asking questions.
So that's advice number one for all the folks watching is don't hesitate to ask questions. But now this brings up an administrative thing, which had come up in a number of articles that I read in researching this. And I know for myself, you go to the doctor's office, most of them are filled with patients. Doctors are overwhelmed. There is an immense amount of pressure just to get through the day because you've got a whole schedule and then emergencies come in and you got to see people who are having, some chronic thing right away. And yet what Dr. Davis said, she closed the computer and she sat and talked to somebody, spent a little more time. I guess we have to be sympathetic to doctors who are I got 14 people out here. I got no time to see them. And just what are your thoughts about that? And how does the department look at those kinds of situations?
I mean, we know that the healthcare system is under a lot of stress, and the last 4 years have made it even worse. People have been burned out. People have seen and experienced a lot. So one of the main things that we do in the health department to really support the public health system, we've actually started this massive initiative for the last couple of years called Public Health Corps. We're looking to
Public Health Corps.
Public Health Corps.
Okay.
Where we were looking at the needs of the city, and we wanted to expand the public health workforce, working with community health workers to have folks from communities with the lived experience and the knowledge, the history, the language, the culture, to actually come in and help folks. They talked to folks about a range of topics. They started out talking about vaccines, getting treatment for COVID, but we realized engaging with folks that people have other needs, social needs. People need access to food. People need access to mental health services. So working with and supporting and bolstering a workforce of community health workers, folks from community, to actually come in and be a part to kind of help that system that's under that stress, that's been a big effort, and it's been really successful in in really expanding that access, the touch points. Because it's not just in the hospital and clinics that care happens. It happens in the streets. It happens in the parks.
Frankly, it also happens in your home.
Exactly.
And it happens when you go to the grocery store and make decisions on, if you don't look and see, how much cholesterol is in the item that you're buying. You mentioned COVID. I want to talk about that in a moment. But I also want to, let's mention about local organizations. Oak Street Health, and I've listed them there in Allerton and University Heights, Soundview, Parkchester, and they have a Simpson office on Westchester Avenue. I thought it was very interesting because there was a photograph that Emily took from the Bronx Times of the waiting area.
Yes.
Talk to me about how that plays in the whole thing, and I want to use that as a clue for viewers to say, well, wait a minute, my doctor's office doesn't feel like that. So talk a little bit about the preparation and the context in which people are seen.
So I'm so happy that Julain mentioned that care happens not in necessarily big systems. It could happen in a community.
Well, that's why I mentioned all the community centers.
So Oak Street is their practice is centered around the community center. Patients come in, they could wait, they could have coffee, they could play games, watch TV, and they're waiting to see the providers. But one of the key things about Oak Street, I think, you mentioned provider burnout, and it's a real thing. And I think people at Oak Street realized that when it started in 2012, how do we tackle the 5% of our population that consume greater than 50% of the healthcare costs? And when we started in 2012 to now in 2024, the older population has tremendously quadrupled. How do we care for that older population who cannot benefit from that 50 minutes of a doctor time? And I think all providers, they have the best intention. They wanna help that person. But the way Oak Street does it is that I am not at the center of the care. The patient is the center of the care, and try to figure out more what the patient needs, from behavioral health to social help. There are a lot of patients who, the biggest thing is, what am I going to eat today? So how am I going to tackle someone's diabetes if I can't help them to eat today? So we do a more holistic approach. Is looking at, for every patient I see, I see them today. What are you going to be in a year from now? Where are you going to be in 5 years from now? My goal is to flatten that disease trajectory and
as
make
much
sure
as I can. It certainly is a holistic view. Let's just talk about COVID. You mentioned to me, and then we'll get to you about it. How did it change what you do? Did it change what you do? I think what COVID did, certainly for what we've done on this program, and you were on the show, it let us see that, wait a minute, we have a big crisis. Some people, unfortunately, many in the Bronx, didn't get the kind of treatment. We may have been last to get vaccinations and services. How did it play at Oak Street? And then we'll talk about the city as well.
Well, I joined Oak Street after COVID, but in terms of COVID, COVID profoundly, in terms of my perspective, COVID kind of revealed to the world what I knew and many providers knew. Look at me, I'm a Black female of color, and I have an accent. And I knew, just within myself, there are multiple levels of care in New York City, from my perspective.
And COVID underscored that.
And COVID just revealed that. I could say personally, my brother died, his wife died, many cousins died, and in the nursing home, many of my patients die. And if you look at the death rate across New York City, Bronx had one of the highest deaths in color compared to Manhattan.
Let's be fair. Part of that is because that there were extenuating circumstances for so many Bronxites, with whether it be asthma or whether it be diabetes. Those kinds of ailments really, as we understand, exacerbated the problem.
But in terms of, I think one of the learning things from COVID, it was one of the darkest times in across worldwide. But one of the lessons learned is what did we do? What are we doing well? And one of the things that I feel that we're doing well, looking at big provider groups, looking at small community groups, looking at how Oak Street was successful, we do well by we go into the community and start in the community. Instead of having these...
reminded you that that's what we need to do.
Yeah, that's what we need to do.
Well, let's see. You've been, Dr. Watkins, directly involved in health equity capacity building, COVID equity. How did that play? What's your vision now? Did we get there? Did we learn something? I mean, the same question really that we asked Dr. Davis.
I mean, for me, COVID was a disaster, but at the same time, as disasters can destroy us, they can actually reveal what is possible. Right. And they can really open up the imagination to what we can do. Right. And what COVID really showed was the power of health equity, the power of this intervention that we are all playing, understanding, having the consciousness, being able to speak to people in different ways, being able to meet people in different ways and go out in the community. That's what COVID really showed, and really showing, in our agency, the effort to expand the public health infrastructure, the power of the community, the power of the community health workers to be at the table. And that was the majority of what we've done, and it set us up to address the new challenges, or the challenges that are just really sinking in about climate change. Another thing COVID is a small response compared to what we have to do
for climate change.
Yeah.
So, again, I can't even imagine it, looking at the size of New York City, the number, how many millions of people we have, and how complex it is, and how complex your system is. How, once you've learned that, once the administrators, the commissioner, assistant commissioners, and the mayor even all learned that, how do you then translate that into action? You get the leaders of every institution together? Do you go place to place? How do you communicate those things? I think that's it's a fascinating thing to me because the city is so large and diverse. I can't even imagine doing it in the Bronx, let alone 5 boroughs.
So I think an important part of the conversation is there's healthcare, the healthcare system, there's doctors, nurses, and everybody in the hospitals, in the clinics. And then there's the public health system, which extends beyond the healthcare system. It's not just hospitals and clinics. Public health, we're food safety. We're inspecting for lead. We're inspecting window falls. We're doing all of this work. And so it takes this kind of zoomed out a bit. We have like on the ground zoomed in, but we also can zoom out to kind of see what are the systems, what is going on in this bigger, in the bigger New York society, right? And so what we do is, what our group does, we know that the power is with the people and that we don't have it all. Our degrees are the only thing, but there's folks who are living out in the streets, folks who've grown up in the neighborhoods and knows what it takes to live in the Bronx and to survive in the Bronx and knows what Bronx needs. So we work with community-based organizations, faith groups, to develop programs and see what folks want and need.
Dr. Davis, let's just talk about that. You address very directly that it's not only, well, you've got some disease or some problem, it's what are you eating, where are you living? I mean, Dr. Watkins addressed those things that directly affect health care. How do you deal with that? How do you identify that? In other words, you can get a profile of a person, but what do you do?
Part of our secret sauce
here we go.
is really hiring people from the community we serve. And we have community health workers who actually
multilingual. I would love to assume.
They actually go to patients' homes, check on patients. They will even go to an appointment with a patient if the patient feels insecure or nervous about that appointment. And actually, I've learned so much from my community health workers. They actually give me heads up. They're like, Dr. Davis, I took my patient, I took Mr. X to the appointment. He didn't look so hot. Maybe he should come in and see you. And Mr. X actually trusts that community health worker because he's so much afraid of care systems. He will trust what she says over what I say.
In a way,
so which is like to me, it's a wonderful.
In a way, it's the old-fashioned home visit, which, of course, if you could do more, you could see more. But of course, with 25 people waiting in the waiting room, it's a little hard to walk out of the office. I see Oak Street as the old-fashioned home visit, but teamed with technology. I always say we are a very technology-driven company with a human touch. We think at the core is that person, but we have so much data that we're able to harness and really try to use predictive models to see how we could impact patients in over their lifetimes. I always tell patients when I see them, my goal is to keep you in your community as long as possible, as stable as possible. And that's our goal. And to me, it's a gratifying thing. I want to ask you, before we wrap it up, and then we'll ask you to give advice to people and to know what to look for, et cetera. What about it? My health insurance is so complicated. And I just got a letter that one of my providers all of a sudden is not going to be covered under my health care. How do you explain, especially to people with different languages, somebody who comes from South Korea, for example, and doesn't speak a lot of English, how do you get them to make sure they have the right health insurance? And it's so fundamental because they're going to come in and say, I got a problem, but I ain't paying the $4,500 it's going to take for the biopsy.
I guess that again, it comes to the question of empowerment and advocacy. At Hook Street Health, we have actually a team that actually advocate for our patients, that will explain to them their health benefits, what plan best suits their health benefits and their health needs.
So you take the time to do that?
Yes. That's very much, that's an integral part of what we do.
Let's start wrapping up. Dr. Watkins, what should people know when they go to the doctor and say, well, wait a minute, I'm not getting what I should be getting? And then once they identify that, what should they do? And we'll ask you the same question.
I think that what people should know is that they deserve good health and they deserve their questions to be answered. And if you walk into that room and something inside is telling you this doesn't feel right,
Just like it did to that 10-year-old girl way back when.
I don't feel seen, I don't feel heard, I may not feel safe here, it's time to speak up, or maybe time to look elsewhere. We do have a lot of choice. Sometimes it can be difficult, but there is choice. And I think that we don't have, I don't want people to think that they have to kind of put up with something.
How do you find the right one?
Sometimes it's like dating. Sometimes you go in, you want to see what is the vibe? How are they talking to me? Are they listening to me? Am I just a number? Am I just a list of chief complaints and medical conditions and pills? Or am I a person?
Is there a database or some way that people can even interact with the Department of Health to get advice on these things?
Yeah, so at NYC Health.
NYC
yeah,
Health.
nychealth.gov. At our health department website, we have a variety of resources, from health insurance to information on the mental health crisis. To there's so many resources locally that are accessible to folks that are low to no cost.
It's the largest industry in the Bronx, healthcare, and so we certainly don't have a limit. Dr. Davis, a little less than a minute. What is your response to my question?
When they come in, look and see if they're someone actually look in their eyes and speak to them, acknowledge who they are. And when they ask a question, see if they respond with an appropriate answer.
Sincere
answer. And most thing I want to tell people of the Bronx, you can actually look up your provider, his grade or her grade, and select what you think is best.
That's true. You can go online and find it out.
Yeah.
Listen, Dr. Julain Watkins, we're going to have you back, so stay tuned. The Assistant Commissioner for the Bureau of Health Equity Capacity Building at the New York City Department of Health. Thank you so much for joining us. Dr. Yonette Davis, the Senior Medical Director at Oak Street Health. We'll remind you, Allerton, University Heights, Soundview, Parkchester, and Simpson on Westchester Avenue. Thanks so much for everything you do and for taking care of our people.
Thank you for having me.
Great. Folks, we thank everybody. We'll thank our producer, Rebecca Hemick, our director, Will Guzman. We have a cast of thousands around us here in the studio. And of course, to you too, the people of the Bronx. So, if the curtain don't fall and the creek don't rise, I'll be back next week. Good night.